Lorazepam, also known as Ativan. The medication classifications include the therapeutic, which is an anti-anxiety agent, sedative hypnotic, or anti-seizure agent. The pharmacologic includes benzodiazepine, GABA receptor agonist. The mechanism of action is that it potentiates the actions of GABA, an inhibitory neurotransmitter in the central nervous system. It is capable of causing all levels of central nervous system depression, such as the anti-anxiety, from simple relaxation to the induction of sleep. Some common adverse effects include dizziness, ataxia, drowsiness, blurred vision, vertigo, sedation, and confusion. Some of the less common adverse effects include hepatotoxicity, alopecia, anaphylaxis, orthostatic hypotension, cardiac changes such as tachycardia, hypotension, cardiac arrest, constipation, dry mouth, nausea, vomiting, and anorexia. Some patients may experience nightmares, talkativeness, mania, sleep disorders, acute rage reactions, anxiety, restlessness, and euphoria. Some common drug interactions include other CNS depressants, such as alcohol, opiates, or other sedative hypnotics. This can cause excessive CNS depression. Oral contraceptions inhibit the metabolism of benzodiazepine that undergo oxidation, which could cause increased effectiveness of the anti-anxiety medication. Disulfiram can cause increased sedation if taken with lorazepam. Valproic acid may decrease the effects of lorazepam. Kava, melatonin, and valerian may cause excessive drowsiness if taken with lorazepam. Excessive indigestion of caffeinated food and drinks may decrease the effectiveness of lorazepam. You should always contact your doctor before taking any other medications with lorazepam. The treatment of overdose includes the overdose will cause sedation, lethargy, and coma. Supportive care should be provided while the patient is recovering. Gastric lavage and activated charcoal may be administered. The benzodiazepine antagonist, flumazenil, may be administered to reverse sedation. Some common nursing administration would include to get a baseline assessment prior to administration, to understand the reason why the drug has been prescribed, in order to assess for the therapeutic effects. Obtain a complete health history including hepatic, renal, respiratory, cardiovascular, or neurologic disease, mental status, narrow angle glaucoma, pregnancy, or breastfeeding. Obtaining a drug history includes allergies, current prescription and over-the-counter drugs, herbal preparations, and caffeine and alcohol use, and be alert to possible drug interactions. Assess the stress and coping patterns of the patient, such as existing or perceived stress, the duration, the coping mechanism, or remedies. Obtain a detailed sleep history, for example, the quality of sleep, restlessness or frequent wakefulness, snoring or apnea, remedies used for sleep, and possible concerns from the patient. Evaluating appropriate laboratory findings, such as the hepatic or renal function studies. Obtaining baseline vital signs and weight, and assessing the fall risk of the patient. Assessing the patient's ability to receive and understand instructions, including family and caregivers as needed. Some assessment throughout the administration should include to assess for desired therapeutic effects, such as improvement of anxiety, appetite, ability to carry out activities of daily living, and sleep patterns. Continue periodic monitoring of liver and renal function studies. Assess vital signs and weight periodically or if symptoms warrant. Assess for and promptly report adverse effects, such as excessive dizziness, drowsiness, lightheadedness, confusion, agitation, palpitations, tachycardia, or musculoskeletal weakness. Ensuring therapeutic effects would include continuing these assessments for therapeutic effects, If the drug is given for anxiety, the patient reports decreased anxiety, or if it's given for improved sleep and eating habits, then improved coping. Nurses also need to ensure the minimizing of adverse effects. To do this, they would continue to monitor vital signs, mental status, coordination, and balance periodically. Be particularly cautious with older adults who are at increased risk for falls. Drugs used for anxiety and sleep may cause excessive drowsiness and dizziness, increasing the risk of falls and injury. Ensure patient safety, especially of older adults. Observe for lightheadedness or dizziness. Monitor ambulation until effects of the drug are known. Dizziness and drowsiness for a prolonged period of time may occur, or the patient may become dependent on the drug. Assess for changes in level of consciousness, disorientation, or confusion, or agitation. Neurologic changes may indicate overmedication or effects of sleep deprivation. The nurse should also assess for changes in visual acuity, blurred vision, loss of peripheral vision, seeing rainbow halos around lights, acute eye pain, and any of those symptoms accompanied by nausea and vomiting, and report it immediately. Monitor effect of emotional status. The drugs may increase the risk of mental depression, especially in patients with suicidal tendencies. Concurrent use of alcohol and other CNS depressants increase the effects and the risk. Encourage appropriate lifestyle changes for the patient, such as lowered caffeine intake, including over-the-counter medications that contain caffeine, increased exercise during the day but not immediately before bedtime, limited or no alcohol intake, and smoking cessation. Healthy lifestyle changes will support and minimize the need for drug therapy. Caffeine and nicotine may decrease the effectiveness of the drugs. Alcohol and other CNS depressants may increase the adverse effects of the drugs. Avoid abrupt discontinuation of therapy. Withdrawal symptoms, including rebound anxiety and sleeplessness, are possible with abrupt discontinuation after long-term use. Assess home storage of medication and identify risks for corrective action. Overdosage may occur if the patient takes additional doses when drowsy or disoriented from medication effects. Assess prior methods of stress reduction or sleep hygiene. Reinforce previously used effective methods and teach new coping skills. Drug therapy is used for the shortest amount of time as possible. Developing other coping skills or improved sleep hygiene may lessen the need for drug therapy. For the patient understanding of drug therapy, use opportunities during administration of medication and during assessments to discuss the rationale for drug therapy, desired therapeutic outcomes, commonly observed adverse effects, parameters for when to call healthcare providers, and any necessary monitoring or precautions. Using the time during nursing care helps to optimize and reinforce key teaching areas. Patient self-administration of drug therapy should be taught by the nurse. When administering the medication, instruct the patient, family, or caregiver in proper self-administration of the drug. For example, taking only the amount prescribed. Utilizing time during nurse administration of these drugs helps to reinforce the teaching. The patient and family should be educated also by incorporating measures to enhance sleep, including avoiding caffeinated drinks within 6 hours of bedtime, avoiding eating a heavy meal right before bedtime, decreasing stimulation such as TV, loud conversation, or bright lights before bedtime, forming a habit of using the bed for sleeping, not for reading or watching TV, and establishing a regular bedtime and rising time. Do not take any other prescription or non-prescription drugs, dietary supplements, or herbal products without the approval of the healthcare provider, because these may interact and cause excessive drowsiness. Do not breastfeed while taking this drug without approval of the healthcare provider. Do not consume alcoholic beverages while taking this medication because this may cause increased sedation. Immediately notify the healthcare provider of any known or suspected pregnancy because this drug has the potential to cause birth defects. Many nursing responsibilities in regard to lifespan and diversity would include many benzodiazepines are included in the Beers list of potentially inappropriate drugs for older adults and warrant careful monitoring. Use special caution in administering this drug to the older adult who is at increased risk for falls, and provide assistance with ambulation as needed, because benzodiazepines are metabolized through P450 system pathways, Monitor ethnically diverse populations more frequently to ensure optimal therapeutic effects and minimize the risk of adverse effects. Always contact a doctor before taking this prescription. Always make sure that you have a prescription for this drug and do not take anybody else's prescription just for light anxiety.